Hello, and welcome to PPM's podcast for November. Today we're doing things a little bit differently, and the fact that we're actually on the road, which is quite different from just coming out to you from our office all the time. So this is something we may actually start doing on a regular basis, but today is kind of really special as we went down to Salisbury University to actually interview and talk to a good friend of mine. Introduce yourself with all your titles.
Well, I am Randy Inslee, and I'm a respiratory therapist, a long-standing respiratory therapist, and I am one of the instructors at ACLS instructors and BLS instructors at PPM. I'm also one of the training center faculty members at PPM. And I teach here at Salisbury University in the respiratory therapy program, and I've been here for, 16, 17 years. But I've been in medicine pretty much 54 years now, so I'm getting a little long in the tooth, but still doing instruction here for ACLS and BLS. And we wanted to share with you a little bit today just to get an idea of maybe some variations on how everybody presents, and we have a bunch of different ways of doing BLS and ACLS with folks. And maybe share one of the ways we do it because we think it's a little unique, and maybe give you an idea for some things that you could do with your presentations and how you can do that.
Okay, before we get into that, let's talk about one of the most recent things that just came out from American Heart Association and the Atlas program. About 5 years ago, they finally let us use just one email address to send all your cards to, because literally not everybody has an email address. So that was always an issue, is trying to get them their card so they could actually open it and claim it, which is a big issue now as far as they got to claim the cards. Well, just recently, that thing that just came out said that the new Atlas program, you can only put a single email address in for a single card, which means if you got 5 people in that class, 5 separate email addresses. You can't put like the supervisor's address in and copy that down, and then he takes it, prints the cards out, and gives them the cards. That won't happen again. Now remember, 5 years ago they fixed that so we could do it, made it easy to get people their cards. They've now reversed that again, so it'll be a little time working this through again until they fix Atlas so we can do it again the easy way. Okay. Can't help but say that, we've talked about that before, that they finally fixed it so we could get the cards to the people. Now we can't do it again. So each person must have a separate, and one of the things they come out with is that if they've got a friend with an email address, okay, if you're sending it to a friend, isn't that a privacy issue with something? So I don't know, we're still doing battle with heart in reference to how can we fix this, how we can get back to the old way, how can we make this work? So that's the only thing I've got to say about American Heart. As you know, we do battle with them on a regular basis, but it's working so far. Atlas has come a lot of ways, made a lot of fixes so far, a lot thanks to Kathy, our program coordinator. She does battle with them almost daily over the Atlas program. And a lot of her suggestions have been fixes that have made it work. So we're pretty happy with that. But okay, let me get back to Randy and let him show you some of the neat things he got down here to do CPR with.
Well, I tell you something, Kathy's mini pod that she just sent out when Atlas helped a bunch, and I'm getting used to it, and it's working fine. So if I can use it, everybody else can get used to it and do it fine. And so we just want to share a couple little things with you about how we have our setup here in the lab, in the respiratory therapy lab. And if you can see, we have 2 monitors here at the table, and Joe's sitting in front of one, I'm sitting in front of another. And you can see that on the walls, there are very large monitors, and this monitor, the one in front of me, is integrated with the monitor up there on the wall. And these are touch screens. This is a touch screen, and that's a touch screen. And we're able then, for the instructor who's sitting here, to change different variables here, like EKGs and so on. And then if we have students that are working up there at the patient, they can also use the touch screen and touch things there, and we can go back and forth with it. It's a really nice interactive way of working stuff. So we have some assistants here. Dr. Megan East from the Medical Lab Sciences program is here, and she's going to help us demonstrate things. She is also a practicing physician assistant, and she also is an ACLS rated person. So But she's never worked our monitor before. And so we're just going to use her to show that there's people that would stand there and would push on that. And so I'll just give you an idea of how we do it. If you've used DartSim, you know what we're working with here. And so we can change the EKGs. So in this case, I have an EKG that's a normal sinus rhythm at 85. I'm going to change it to an MI. I've got a STEMI. And you can see that it changes both on my monitor and on hers. So at this point, I can change it. And then the students who are working up at the patient can make changes as well from there. We also have a crash cart there that can be integrated in the whole thing and, go through the routine. So if I'm looking here and I say, okay, so I have a patient now who has let's just say they have a really fast heart rate of 200, and this is a patient who maybe has serious signs and symptoms. We can reduce that blood pressure down if we'd like and show it there, but we're just going to say that our person has a blood pressure of, 60 by palpation. We're really losing it, right? So we're thinking about at this point that this person would need to have something done immediately, and you all know the drill, so we would be looking to do maybe cardioversion. So at this point, we could turn it over to our student and so go through the routine, and our student could say that the first thing they're going to do in this case is maybe synchronize it, right? So we can push the synchronize button there, and then the student would be able to point out to you where it indicates that it's in the sync mode. And we can then put on some medications perhaps that you can see could pop up there, and then the student could touch and pick out medications and dosages from there, and we get our patient ready. At that point, we can look over here on the right-hand side, the lower right, and pick an appropriate amount of watt, seconds, voltage, joules, whatever we're calling them now, and pick that here, and you can reduce that if you like, or increase it, either one, right? And we've got the sound turned off, but then we could charge it and clear the area, and then shock our person, and clear, and then shock our person and go from there to cardiovert our patient, and then look for wonderful things to happen there, which they did. Our patient has been saved. So I just show you here that this is an opportunity to do something a little bit different, a little different way of teaching this and integrating the technology now. Like I said, we can do two at once. And just if you happen to be in education, or if you happen to have facilities that are like that, not everybody can, we understand that. But it just gives you an idea of some of the things that we think a little bit out of the box. That we get to the point where we have students who actually portray the teacher here. And so it gives them a little more responsibility, and they have to be a little more prepared as they go through. So that gives you an idea of what we're doing here, and we thought we'd share that with you to kind of give you some different ideas and stuff.
Okay, so you saw not everything is just 1, 2, 3 and be done. So this is really a complicated and sophisticated system. Now, we understand that not all of you are going to have a system like this. But again, every one of our training locations does things a little bit differently, and I'm kind of in favor of that. I'm not necessarily go for the cookie cutter. I want people to think out of the box, how to get this done, how to get it done correctly. So if your training site or location is interested in us coming to you and doing a little mini podcast from your location, and you can show everybody how you do your system and how your system works. And that way all of our instructors can get different ideas, different ways of doing a good class, something that we're proud of, and proud that you're part of PPM. Okay? Again, that's pretty much it for our podcast. Thanks for watching, and we'll see you again soon.